Now, children who are injured and sick need your help. And today, Kapiolani Miracles for Kids is raising money to help those keiki in need. The telethon started at 5 a.m. and runs to 7 p.m. and it's right here on KITV4. As a matter of fact, we're a proud partner. And joining us now live is our very own Kapiolani Richardson, who is at the Kapiolani Medical Center for Women and Children. Good morning, Kapiolani.
Good morning, Dan. Well, this is definitely the place where you can make a miracle happen. And if you happen to be shopping around today, if you go to Walmart, Costco, Sam's, or Ace, you can buy these balloons and help donate to Kapiolani Miracles for Kids. $5 will buy you a big balloon and $1 will buy you a little balloon. And all the money stays right here in Hawaii. It goes to the Kapiolani Medical Center and the Children's Miracle Network, which is a non-profit organization. The volunteers got here at 5 this morning and they are answering phones, waiting for your donation. The number to call is 951-KIDS. That's 951-5437. If you're on the neighbor islands, there's a toll-free number that you can also call. It is 866-856-5437. It's so amazing. As soon as we went live this morning at 5, people started picking up their phones and donating to this really wonderful organization. Now, some of the children that the Children's Miracle Network helps and Kapiolani helps is folks like Ariana Diaz. She is 15 years old and she is a brave cancer survivor. Here's her story. No one knows a child better than that child's mother. There's something intuitive about being a parent, especially a mom. Julie Diaz, mother of 15-year-old Ariana, started getting concerned back when she was only 6.
She would be tossing and turning. Her back was hurting.
She has a tumor. It's a rare tumor. It's a muscle tumor. It's called a rhabdomyosarcoma. And she had her initial disease when she was about 7, and it started in her neck area.
Ariana withstood 3 major surgeries by the time she was 7. She couldn't walk for 6 months. In addition to the surgeries, Ariana had a catheter placed in her body, a special line traveling all the way to her jugular vein to administer medications. She underwent 39 weeks of chemo treatments, 5 weeks of radiation therapy. 4 years later, the cancer was back.
They found 4 on her head, 1 on her breast, and a couple of lesions on the bottom of her leg. And I said, well, what's that? It came back. So Dr. Bob gave us a new roadmap. We've been through this before. Let's do it again.
She responded to her initial therapy very well. We were able to get the tumor to go away and in remission. We've completed all of her initial therapy. And then about 6 months later, she developed reoccurrence, so she had relapsed. And then we embarked on some surgical removal and radiation therapy and more chemotherapy, and she did really well, and we finished her therapy and then stopped for about a year, and then she discovered a lump in her thigh, right in her thigh area.
We try not to sugarcoat anything. You know, we tell her everything that's going on.
We had to tell Ariana we had to go through this again. 42 weeks of chemo, 2 weeks of radiation.
Ariana is now off therapy, but Dr. Bob is closely watching her for any sign of reoccurrence. Hang on just a second. And back here live at Kapiolani Medical Center, folks like Ariana are so brave. She's actually in Washington, D.C. as Kapiolani Medical Center's and Children's Miracle Network's champion child. She just got a tour of the White House and she got to meet several Congress members. She's hoping to meet President Barack Obama, who was born here right at Kapiolani. And some of the other folks here at Kapiolani are Dr. Keith Matsumoto. He's the chairman of the board and he's a pediatrician. Good morning, Dr. Matsumoto. Thanks for joining us. So why should people pick up the phone and donate to Kapiolani Miracles for Kids, and why is it so important for you?
Well, we are the only children's hospital in 2,500 miles. And people probably don't realize this, but for a population of our size, most cities in the United States do not have a children's hospital. It's estimated you need 3 to 4 million people to really support one. So with 1.2 million people in our state, we're really, really fortunate to have a children's hospital. So we really need the funding.
Oh, fantastic. And Dr. Matsumoto, you're also a pediatrician. You see kids all the time. And hey, guess what, Dan? I just found out that this is your kid's pediatrician. Do you have any questions for the doctor since I've gotten here?
Oh, it's so funny. It really irritates my wife. But every time I see Dr. Matsumoto, he's also a fellow Celtics fan. And so I know he's a little disappointed this morning as well as I am. So you can let him know, yes, Boston Celtics. That's the only thing we usually talk about when I see him. And the kids' health, but my kids are healthy, fortunately.
And Dan says that he's really disappointed about the Celtics.
So am I.
See?
You can commiserate together. Well, Dan, I know that you're going to be here live for the Kapiolani Miracles for Kids. Again, it started at 5 this morning. It goes all the way till 7. And folks like Dr. Matsumoto just have a wonderful story. You can come meet them here. And again, the number to call is 951-KIDS. And there's a toll-free Neighbor Island number, 866-856-5437. All of the money stays right here in Hawaii for Kapiolani Medical Center. We are reporting